What does it mean to be clinically depressed?
Well, the DSM identifies 8 symptoms for clinical depression. Lack of desire to do anything. You have thoughts of ideas of suicide after prolonged depression, tiredness, sleepiness, just this general lack of desire to just participate. So that is what clinical depression is. Any of those symptoms identified over a 2-week period or longer can lead to a diagnosis of clinical depression.
Does someone typically suffer some sort of depression at some point of their life, even if it's temporary?
Absolutely. Anyone can suffer from temporary depression, either due to circumstantial situations, maybe the death of a family member, maybe just a hard moment you're going through life. But for clinical depression to be diagnosed, it has to be a specific set of symptoms over a specific set of time.
So where does it stem from?
The beginnings of depression is multifactorial. They might be family inherited because there is a genetic loading. There is family history of previous members of the family who have experienced depression, and this can be transmitted from one generation to the next or the next or the next one. It could be part of the fact that during the development, during their childhood, they were exposed to lots of traumas of a psychological nature, and in the formation of their psychic capacities to tolerate and deal with the stress, they became deficient and impaired to the point in which they did not know what to do. It also has to do with environmental factors and exposure to stress and trauma through the continuum of life as you grow up.
So how do you diagnose this?
By identifying the symptomatology,
Right.
getting a very good clinical history, identifying the presence of depressed mood, the signs and symptoms that Anna just listed a few minutes ago, getting a good history of family depression and or psychiatric disorders, also a history of substance abuse in the family members, and identify medical conditions or rule them out as the possibility of them being the cause of depression. Once these have been ruled out, it is psychological and is fully psychiatric.